Hi, and welcome to our December parent counseling and training session. Today, we're going to be discussing communicating internal health symptoms and how to work with our students, our children, on helping them develop the language or skills to communicate when something is wrong, right? When they're feeling wrong, when they're feeling off, or if they're sick. I know a lot of times, our children on the spectrum they struggle with these, core communicating skills that are so vital, especially, we struggle taking our children to the doctor and, we want to be able to help them communicate, especially as they get older, right? And, we want them to kind of develop those skills to be able to, you know, maybe take themselves to the doctor and be able to communicate these things on their own in the long term. I'm Stephen Emerson. I'm the counselor here at Hawthorne. Um, Jim Horan helped me develop the slides. Just me here today, but Jim, I got to give him credit. He helped me a lot as well. So today, communicating internal health symptoms. So, what does this entail? We're going to talk about, what is interoception, right? You talk about our own perception, right? Things that we see. Interoception, you might have heard it be phrased as the eighth sense, right? So this is the sense of, we perceive and interpret internal signals that our body is telling us, right? So this may range from hunger pains, thirst, fatigue, nausea, anything going on with our stomach, our heart racing, feeling of goosebumps. This could be sexual arousal, muscle tension, toileting urges, and pain, right? So our interoceptive awareness is mediated by a network of sensory receptors located in various organs, including the heart, lungs, stomach, bladder, eyes, and skin. These receptors send signals to the insula in our brain about the state of our body's internal environment. Our brain then uses the information about how our body feels as clues to our emotional state. Are we anxious, sick, tired, excited? Right. So, how do these feelings contribute to our emotional state, which is very important? When we see individuals, who are on the spectrum who may be struggling with just communication in general, right? And we know that a lot of our receptors can definitely be impacted. Here's just a little infographic on how it's all connected, right? So our thirst or hunger, goosebumps, nausea, pain, heart rate, muscle tension, and then the emotions, right? And how does one lead to the other, right? So our emotions can often have an impact on our physical state, and then our physical state obviously has a lot of impact on our emotions, right? When we're not feeling well, right, we may be more irritable. We may feel depressed, sad, anxious. I know, especially when I feel sick, right? I'm feeling, I'm very easily irritable for sure. I know my family would probably attest to that. But yeah, and so especially, right, when we sometimes the emotional stuff is what we're going to see first, right? Especially with our kids, if their first instinct isn't necessarily to be able to say, hey, I'm feeling nauseous, or my stomach hurts, or I feel thirsty or hungry, right? If they don't have the skills to communicate those things, right, we're going to see it in emotional perhaps outbursts, or we're going to see it in the emotions or even behaviors too, right? So they may have, we may see a behavioral outburst as well. So very important to sort of see those, the emotions and then the behaviors are going to be your first inkling, in the sense that something might be off, especially, as we're heading into winter. It's actually not even, I don't think it's officially winter yet as of recording this, it's late fall and it is freezing, right? So, it's definitely that time of year, right? Flu season, the common cold, a lot of stomach bugs. In my house, we just got over a round of stomach bugs. So there's a lot going around. So it's definitely important to, I know here at school, we're definitely keeping our eyes open on the kids and, we'll see, we're going to see the emotions or behaviors first, especially if they can't necessarily communicate that something is going on. So interoception and autism, right? So, children on the spectrum, they're going to have challenges, maybe not 100% of the time, right? But, definitely possible challenges in identifying basic needs. They may have emotional regulation difficulties. Many autistic individuals are also alexithymic. Alexithymia is a condition in which a person has difficulty identifying and describing their emotions and is closely associated with interoception differences, right? So, definitely working with a clinical professional, you can definitely work on identifying, whether, this is predominantly difficulty in identifying, in association with being on the spectrum, or is this alexithymia? With a clinician, you'd be able to sort of suss out the differences. But definitely want to keep an eye open as well, especially if I see it as a counselor. If I'm working with an individual, when we're working with a student who, a lot of our goals are identifying feelings. If they're just not quite getting it, or they really are struggling getting there, this might be something to consider an assessment for. We also, being on the spectrum may also impact our receptors, right? So there may be a heightened or diminished experience of pain, right? So it could be, hyper awareness or hypo awareness to like cold or heat or just pain in general, right? So we're going to talk about strategies for support. So engaging in interoceptive awareness training, we discussed a little bit here. However, there are definitely more resources out there. I have a link at the end of this slide for a website that I definitely encourage you checking out, reading more in depth on interoception and seeing how this may be playing a role with our kids. Involving visual supports and communication tools. We'll get into further examples later on in the slide, but this might involve their augmented communication devices. This could be simple printouts that you can point to. This could be use of sign language, right? So using alternatives, for communication, providing a consistent routine. So as a counselor, what I often do is emotional check-ins with students. How are you feeling today? We would talk about the severity, the intensity of that feeling. Maybe create a routine where you're doing a regular check-in with your child on, when they wake up, how are you feeling today? On a scale of 1 to 10, or you can have them point to different visual aids. As I said, you'll see some examples later on. But yes, making it part of your daily routine could be super helpful. Making it second nature to discuss feelings, physical and emotional. Modifying the environment for sure, right? If you find that your child has a hypersensitivity to temperature, texture, maybe they tend to get nauseous around particular smells or sounds, maybe motion sickness, right? Sort of take it into account different triggers. Make space for stimming, right? So self-stimulation can be a result of something that's triggering for sure, right? And it also could be a normative behavior, right? You kind of know your child the best in terms of like what is the function of the self-stimulation, right? If it is out of the norm for them, that might be a red flag that something maybe they're not feeling well, right? So kind of use that as a cue. But if it is something that's sort of common and you notice that it's more of a regular occurrence, make space for that. Allow them to have that stimulation that might actually help them self-soothe, right? I think sometimes, especially, we often feel like, as parents of children on the spectrum or, whatever the mental health diagnosis might be, right? There's a lot of stigma, right? And we feel like, especially when we're in public, right? Sometimes we get anxious or nervous, like, how are people going to react to our child? So, we still want to create that environment for them to be able to have that relief that stimming might provide. Offering understanding and validation, right? So giving them that space to communicate, whether it's through stimming, through their words, through visual supports, offering those, offering empathy and listening, and giving that it's okay to express those things and then validate for them. Using the correct language for the body is very important. We don't want to necessarily, like, it's important. They need to have the language to communicate what's going on for them, and that includes, body parts. So I think so. Oftentimes, right, we can feel uncomfortable with like, we're not necessarily doing sex education, right? But you want to use the appropriate language for body parts, so that they can actually communicate if something is wrong, right? They never want to feel shame around saying like, "Oh, my private parts hurt," right? That's important as parents and caregivers to know, right? So give them that language. And again, verbal communication isn't necessarily an option, right? Having appropriate, um, you know, uh, body charts, something that they can point to, or teaching them to point to themselves. And then recognition versus communication, right? So this is sort of a twofold process of, helping our children recognize when something is wrong and then communicate that, right? And so that could be a dual process, or you do one step at a time, really working on like, what does it feel like to have a headache, a stomach ache, right? Like how to recognize that. And that could be images of, people with stomach aches, right? Maybe clenched over, sort of holding their gut or holding their head with like a sad face or, an anguished face. So there's sort of ways, through social stories and images to relate to that recognition and then be able to put the words to it to then communicate once they can recognize when it's happening for them. So oftentimes, right, our kids experience hyper awareness or hypo awareness. So hyper awareness is the increased sensitivity, right, being acutely attuned to internal aches and pains. Hypo awareness is the reduced, right, not really noticing thirst and then may become dehydrated, right, as a result of that, because you're not really feeling that thirst sensation or that hunger sensation, right? Oh, I haven't eaten all day. I haven't really noticed any hunger, and now I'm feeling lightheaded by the end of the day, right? Or my sugar's low, or right, whatever it might be, right? So that, definitely keeping an eye on, like if your child has hyper aware or hypo aware, right? I mean, you're going to have two different sort of approaches here, right? With the hyper awareness, right? For them, their pain may realistically be at a 4, but they're expressing it like it's a 8, 9, 10, right? So really helping them have that language of rating it appropriately. And then you could have various images associated with those numbers, right? Maybe having a face that's increasingly showing pain, like emotionally, um, for each number as well, right? And then the hypo awareness, right? Just keeping track of our child's hydration level. Have they eaten? Are they appropriately clothed for the season? Right, summer, fall, winter. So definitely something you can track, especially also at school, right? We would definitely help with that. Understanding their medication and diet restrictions, right? So really looking at the side effects of any medications that they may be on, right? So if you're seeing a particular symptom, right, is it related to the medication or is it related to an illness? Right? And that's something you could really if you stay connected with your child's doctor, prescriber, right? If it's a psychotropic medication, their psychiatrist, um, and really staying on, up to date with the doctor and keeping the doctor up to date, right? So you can use journals, blog patterns, or any changes that are occurring at home or at school, right? We do a lot of data collection here at Hawthorne, around behavioral management. But right, so if something is a concern to you in terms of like symptoms, we could definitely add that to our data collection here and keep track. That way, you don't feel like you're kept out of the loop when your child's here at school with us. And the log can include bathroom usage, their appetite, their sleep, and any other important daily functions that might be relevant. So consider discussing any supplements with your doctor, right, when diet restrictions are a concern, right? If our children, are kind of hyperfixated on particular foods, or they don't like certain foods, so we're worried about their nutritional intake, vitamins, minerals, and all that. Talk with their doctor about supplements, to make up for any sort of nutritional loss that might be as a result, that might occur as a result of any diet restrictions. So tools for communicating, right? So using their augmentative alternative communication, right? Any AAC device, which has sort of made things super simple in terms of the upload. They all have now they're it's all iPads usually. Right? I know they used to be separate devices. A lot of the iPads have like the apps on it, and you can customize as you need, and kind of keep things kind of nicely organized. I was like, especially as a counselor, right? I'm working on a lot of the emotional regulation and identification, so I like to have all the feelings in one folder. And so it's all kind of nice and organized for them, and then it kind of teaches them to categorize certain, language. Visual aids, right? So these are things that could be uploaded to the communication device, or it's always helpful to have them printed out. If you go to the doctor, I'm sure you've seen the pain charts, body charts with labels. You could do physical printed picture exchanges, and using sign language as well. And a lot of the children's programs now will use sign language in conjunction with verbal language. So it's really nice to see that shift culturally, but it's also super helpful. So just some examples. So you'll probably see this on the augmented devices or the iPads. You can also print these out. So our speech team was able to provide this for me to show you, and I'm sure a lot of you have probably seen these, right? So you can have, hunger, pain, thirst, feelings of tired, and then obviously you want to have the body parts as well. That way they can kind of press one and then the other, right? Pain, head, tired, needs for bathroom, play, drink for thirst, and then body parts. So if you see it in black here on the bottom right corner, body part is going to have that's a folder, right? So you're going to be able to go in and select different body parts there. Having a body chart here, right? So head, forehead, so forth. What does it feel like, right? So you can have in kind of a three-step here, right? So you have the body part, you have what does it feel like, dull, cold, sore, bleeding, itchy, with someone scratching. And then you can even, when we teach our kids these things, we can act them out, right? Kind of, and you can almost even make it fun, like almost charades, right? And don't be afraid to sort of like play it up to a 10, right? That way they're really learning, like, okay, cold, I'm shivering, itchy, scratching, you can really show them, be very clear. And then once they identify what the feeling is, then they could scale it from 1 to 10, right? One being the least, 10 being the most. I also like to have left and right as well, right? So if they're learning left and left hand, right hand, left knee, right knee, and you can really sort of help them really pinpoint. And then giving them sort of a yes no option as well. So this is sort of like a nice little summary that you can use to communicate. Just another example, understanding pain level, right? So a little more simplified. It doesn't have the entire spectrum, so you could pair this with a body chart. But yeah, 0 to 10, no pain, worst pain. And you see, I like that it has the, you'll see a lot of these have like the emotional piece of it, right? A lot of times we just kind of assume like, oh yeah, that they all do that, but it is really helpful here. And you're showing them sort of the severity of the emotional impact of their physical pain, right? Like mild, like a dull, mild pain, we could still be happy, be okay. It's just, we're aware of it, it's there, right? And then as it gets worse and worse, right, we can sort of see the emotional impact of that pain, right? So to sort of help our kids understand, especially as we're going back talking about that hyper and hypo awareness, helping them understand like, oh, okay, like I'm feeling really bad, but it's not really at a 10, right? There's all these other options, right? Is it really up that high? Yeah, and here's that a reference. Here's that website I was talking about. So a lot of this information we pulled from there. We'll also have it as a clickable. in the show for you guys as well. And then our contact. Jim and I will have that up there, so you can shoot us a call, email. But yeah, so very simple presentation for you today. But it's sort of the interoception in the internal symptoms communication can really be a big deep dive. Sort of the purpose of these is to really, introductory, kind of get the conversation started. But it is a process. You might want to consider if this is something that you and your child are struggling with, maybe making it part of their IEP goals as well, right? So speech, OT, counseling, PT, right? These are all services that can help your child communicate these things as well. And we could definitely, if they're not on their IEP goals, they certainly can be part of the IEP goals. As it's a very important skill, especially as they get older. But yeah, we'll be back in January with another topic. Let me check real quick what January is going to be. Will be dietary and meal times, and working on routine around diet and meals. So also sort of relevant, as we're talking about internal symptoms, you know, hunger and thirst is definitely a big piece of that, right? And helping our kids, communicate those needs as well. And when is it appropriate to stick to a particular routine, especially as we get into diet restrictions, nutritional issues. Yeah. So thank you again so much for checking out our December parent counseling training. We will see you again in January.